Welcome to State of the Heart, the monthly podcast from the Community Care Network of Kansas. I am Denise Sisman, CEO of Community Care. Each month, State of the Heart will explore how we, our partners, and state leaders achieve our mission to deliver equitable, whole-person care to all Kansans, especially those who are underserved. We will explore foundational beliefs, policies, and practices through the lenses of community, care, network, and Kansas. Today, we shall discuss the theme of Kansas. And joining me today is April Holman, Executive Director for the Alliance for a Healthy Kansas. April has 2 decades worth of experience as a licensed attorney working toward improving public policy in Kansas. Before coming to the Alliance in 2018, April worked for the Kansas Legislative Research Department, as well as the Kansas Action for Children, and she was the executive director of the Kansas Adult Care Executives Association. April and I have had the opportunity to work side by side for several years now. It's always a pleasure to work with her. I learned so much from her and am so grateful for her leadership. And I know, April, we're going to have an awesome discussion today because we're going to be talking about something that is near and dear to both of our hearts, and that is expanding Medicaid.
That's great. Thank you so much, Denise. I'm really grateful for the opportunity to talk about this and really grateful for the opportunity to partner with you and the Community Care Network of Kansas.
So let's get to it, April. I'd like to start by acknowledging that the efforts to expand KanCare, our state Medicaid program, are not new. Back in 2010, the Affordable Care Act was passed, which incentivized states to expand their Medicaid programs to provide health insurance coverage to many individuals, millions of individuals, who would otherwise fall in the coverage gap. So April, let's start there. Tell us a little bit about the coverage gap and who are the folks that fall into that?
Sure. So it's actually really counterintuitive to think about the coverage gap. We find that there are people in our state who make too much money to qualify for our traditional KanCare program, but they don't make enough money to qualify for assistance through the Affordable Care Marketplace. So in order to qualify for that program, you have to earn at least 100% of the federal poverty level. And then on the other end of that, in order to qualify for KanCare under current eligibility requirements, you have to, you first of all cannot be a childless adult. A childless adult, for the purposes of this determination, is anyone who does not have a child under the age of 19 living in their home. So those individuals who are considered childless adults don't qualify for the KanCare program currently, no matter how low their income is. And if you do have a child in your home under the age of 19, you can't earn more than 38% of the federal poverty line. So just to give you an idea of how low that income level is, a family of 3, so for instance, a mom with 2 children at home, couldn't earn more than about $8,500 a year before they earned too much to qualify for KanCare. So you can see that it's pretty difficult to qualify now, and there are tens of thousands of Kansans who are falling in the gap and really don't have anywhere to turn to find affordable insurance and the access to affordable care that brings. The majority of people who fall in the coverage gap in Kansas are working. They're just working in low-wage jobs, and either they can't afford the employee premium to take advantage of their employer-sponsored insurance, or in some cases, their employer doesn't offer insurance at all. So really, I think that there are sometimes misconceptions about people just choosing not to work and wanting to take advantage of getting this insurance through the KanCare program. That is not the case when we look at the data about who would qualify if we were to expand eligibility for KanCare.
Yeah, so boy, that's not a lot of money, is it? And even those, who do make more than that are and still fall in the coverage gap, they're not able to afford the insurance that they need. And yet, we know they all still need health care. Everybody needs health care to keep us healthy and to also help us to treat whatever illnesses or accidents or diseases that come upon us. I think there's somewhere around 150,000 Kansans who fall in that coverage gap. And, because they do need care, we know that many of them are coming to the clinics that we represent, which are clinics in the Community Care Network. They're health centers and other community-based clinics that are throughout the state, providing health care, high quality, again, whole person care for the mind, body, mouth, and all other kinds of aspects of health to everyone, all Kansans, regardless of their ability to pay. So when you think about those 150,000 Kansans, many of them already are being served by clinics in the Community Care Network. We have estimated, and it really is, quite frankly, a conservative estimate, that care that has already been provided by our clinics for uninsured Kansans could have been compensated at about $16.7 million if Medicaid had been expanded. So let me put it a different way. If KanCare had been expanded and we were still serving the patients that we're serving, KanCare would have paid for about $16.7 million of care that was provided. Right now, that burden, that economic burden, is being placed on the clinics themselves and the communities and funders that support them. We also know that $16.7 million would translate into something like $32 million in additional economic activity in their communities. So let's talk a little bit about that. How do you think expansion itself can benefit Kansas communities as a whole?
So I think that that's it's really interesting to look at that, Denise. So we know that costs are rising for Kansans across the board. So costs for food, costs for shelter, costs for healthcare really is no different from those other things. And so when we look at the ability of families to be able to afford their care, and to be able to afford to purchase other things that their family budget needs to take care of, expansion can really be a key factor in that. So we know that, just because people don't have insurance does not mean they stop getting sick, unfortunately. And when people who are uninsured or who don't have that access to some sort of coverage to help offset the cost of their health care, seek care from clinics or hospitals or other providers, that ends up very often creating an uncompensated care problem for the provider. And so really, that in some cases can be taken care of or written off, but in many cases, that means that everybody in the community ends up paying more for their care because the providers need to be able to, pay for the infrastructure and personnel and equipment that they have one way or another. And so really we see expansion as being one way to help curb rising healthcare costs. And that certainly has happened in states that have already expanded. We see the rate of their healthcare costs going up at a slower pace than in states like Kansas that have refused to expand.
Wow. And so, I'm struck by this when I think about the fact that we've been having these conversations about the economic impact of not expanding KanCare, especially, on the healthcare providers, 12 years now. Fast forward to 2020 and COVID-19 arrived in the United States, in the world, in the United States and also in Kansas. So we've been struggling with this pandemic now for more than 2 years now, and we have seen how it has just disrupted our lives in so many ways, and across all people, across all types of companies and businesses across Kansas. And so I want to kind of maybe narrow our focus a little bit on the economic toll that COVID has had, and how maybe expanding KanCare is even more important now, given that costs are rising even greater than they were before for everything, including healthcare.
Yeah, so a lot of the people who are in really jobs we rely on every day, people who work at grocery stores, and people who are, working in schools, sometimes as bus drivers and lunchroom aides, and any number of positions that we really rely on as communities on a regular basis, are the very people who fall into the coverage gap. And so we see, particularly with the pandemic, but also with economic fallout from the pandemic, a lot of issues that kind of surround those individuals, their ability to stay healthy and stay on the job, and the ability to keep from having either supply chain issues or just issues within, particularly, schools and businesses trying to find enough people to be able to do the jobs that are necessary. So, I think by having a way for individuals who are on the front lines to be able to maintain their health and be able to access care when they need it, that would make an enormous difference, particularly as we face this kind of all-encompassing fallout from the pandemic.
Yeah, absolutely. And we see that the federal government is considering this as well, because they understand the importance of providing healthcare and coverage for healthcare anytime, but particularly in this time of the pandemic. And so we've been hearing a lot in the news over the past several months about the Build Back Better bill, and how it has a temporary fix for the coverage gap in it for states like Kansas. Could you tell us a little bit about that temporary fix and what that would mean for Kansas if we were able to expand KanCare?
Sure, yeah. So the federal government has actually looked at several different ways to help close this gap. Last year in the American Rescue Plan Act, the federal government actually provided a new financial incentive for states like Kansas who have refused to expand eligibility for Medicaid, to be able to draw down more taxpayer dollars back to the state. If they were to expand, we are one of 12 holdout states at this point. So, and that would, we know, or it's estimated that would bring in somewhere between around $330 million to about $468 million in one-time money as an incentive to Kansas. So that's part of the federal equation. And then the Build Back Better Act that you mentioned would be potentially even more of a source of relief for people who are in the coverage gap and the providers who care for them. So Build Back Better, as it passed the House, the U.S. House, it would have provided the ability for people who are below 100% of the federal poverty line to participate in the insurance plans through healthcare.gov. So right now, people who don't make at least 100% of the federal poverty line are barred from participating in that. So this would open up a whole new range of private insurance for individuals in the gap. It's temporary because it would only be through the end of 2025, but that would be an amazing source of relief for people who need care now. And it would give us a chance to come up with a more permanent solution through expansion here in Kansas at the state level.
Right, yeah.
Right now, I would just say There's been a lot of back and forth at the federal level about Build Back Better. And most recently, that was put on ice, is what we hear from our national partners. So we're not exactly sure when that will come back up, but we know that the provisions like the coverage gap fix are still at play at that federal level. And so whether those would be in Build Back Better or in some other form, we still are cautiously optimistic that there might be some relief that would be provided at the federal level.
Okay, well, good. And of course, there's nothing that stops us from expanding KanCare on our own without having that additional federal relief. So we're hoping that our legislators are able to consider the importance of that, especially again during this time of crisis with the pandemic, but just in general overall, it's the right thing to do for Kansans. And as we think about that experience, you mentioned earlier experiences with other states and what they're seeing economically related to that. We've had a lot of experience with other community health centers in other states, and Medicaid expansion has really helped to strengthen their infrastructure, their health centers, their clinics, and they've been able to provide more care, better care, different kinds of services. So undoubtedly that other state experience is absolutely helpful for us as we think about what does expanding KanCare mean for Kansas. And unfortunately, we're in a situation right now where all of our surrounding states, so we say that we're an island now in the states, with the states around us all having expanded Medicaid. So what do you think is the impact of that on Kansas, and how is the fact that all of the states that border Kansas have already expanded their Medicaid programs?
Yeah, I don't think that it helps us, just to be honest. So, one of the things that we're hearing from our partners in healthcare, particularly along the border areas, so border communities in the Kansas City metro, and kind of along that border with Missouri, and even to some extent with Oklahoma, we see Kansas healthcare professionals being lured, or at least attempts being made to lure those professionals across the state line to work in clinics and hospitals and other practices where there's less uncompensated care, and so more resources for those employers to be able to offer the healthcare professionals. So, it's a situation, I think, where there is across the board, there is a workforce shortage in healthcare, and this just makes it worse for our Kansas providers because our neighbors are looking to us as a source. I think that there are also, implications in terms of economic development for our communities. So even outside of the healthcare arena, all of our businesses are really, wanting to attract, all of our communities are wanting to attract new businesses to locate here. And, there's a relationship between a community's ability to attract and retain businesses and the viability of their healthcare infrastructure. So particularly when we look at rural communities, being able to say that they have a full service hospital makes a huge difference in being able to even be on the list of communities that are considered by businesses when they're looking at where they're going to expand or whether they're going to stay. So I think it's very much interrelated. The financial stability of the healthcare infrastructure, particularly in rural areas, it is suffering right now, and that's only going to become more of an issue as our neighboring states have expanded eligibility, have reduced some of the uncompensated care problems, and that has helped the bottom line of those providers.
Yeah. And, as I think about that too, very well said, by the way, workforce shortages are so significant right now. And we know that it's across the board. I deal with it day in and day out with the healthcare provider world or through their lens. But also, we all go to restaurants, we all go to grocery stores, we go to school, our kids are in school, and there's just not enough people who are in the workforce right now for a wide variety of reasons, which we don't need to talk about right now. But I think that the point that really is important for me when I think about this is that Kansas doesn't need any more challenges thrown at it when we think about workforce. And in fact, we could use a little extra boost, and expanding KanCare would be exactly what we need to help break down any additional barriers for people wanting to work in Kansas and, quite frankly, even live in Kansas. And then also could bring that little bit of extra boost for those employers who are trying to recruit and retain the very best employees.
Yeah. I would just piggyback on that a little bit, Denise. We know that there are many people in Kansas that would like to rejoin the workforce or perhaps join the workforce for the first time, but they have unmet physical or mental health, behavioral health needs that need to be addressed. And so in some states that have already expanded eligibility for their Medicaid programs, they've found that people are actually able to enter the workforce and able to keep their jobs in ways that they haven't before. And so that actually adds to the number of available workers who are out there for our Kansas employers.
Yeah. If I could just add to that, dental as well, oral health is so important when we think about employment. Yeah.
Absolutely. Yeah, I'm glad you brought that up.
Mm-hmm. So, April, last year, the Governor's Commission on Racial Equity and Justice reported that expansion would be the single most important thing that Kansas could do to address health equity. As our network of clinics know, we already are working with individuals who experience a lot of health disparities, and the whole area of equity and justice is a really big challenge for them. When we think about health equity and KanCare expansion, do you think that it is an equity issue, and how could expanding KanCare help to move our state forward with advancing health equity?
So I think that the issue of health equity is one that is multifaceted, and there are probably a lot of ways that we need to do better in our state when it comes to equity. But certainly we know that nationally, African Americans, for instance, face higher rates of diabetes, heart disease, and cancer. And they have, uninsurance rates that have been addressed again in states that have expanded already. We've seen uninsurance rates for African Americans go down significantly. So that helps them to be more likely to have a primary care physician that they see, more likely to receive routine checkups, and more likely to be able to get consistent care and treatment for chronic diseases as well as other health needs. So I definitely think that this would be a great step in the right direction to addressing health equity, and one that really is long overdue in our state.
So April, we've been talking throughout this entire interview about how we've worked together. I represent an organization that serves a network of clinics, community care clinics, that provide high quality whole person care to everyone, regardless of ability to pay. And, KanCare expansion is extremely important to them for the reasons that we've talked about. So, it's not surprising that we would be having these discussions about why expanding KanCare is so important to us. But what do you think the everyday Kansan thinks about expanding KanCare? Do you think that they understand the importance, either to themselves or to their neighbor or to, somebody that lives in their community or works in their community?
It's interesting that you would ask that, Denise, because it's taken us so long. We've been working on KanCare expansion for years. And yet, when you talk to everyday Kansans, they are very supportive of this policy change to make sure that more lower income people have access to coverage. So a recent poll that has just come out this year shows that 78% of Kansans support KanCare expansion. And they really see the importance of making sure that low-wage working people have access to coverage. And they understand that it impacts all of us. When there are people who don't have the access to care, or they don't have the coverage to pay for care, we all pay for that as a community. So it really seems that everyday Kansans get it, and we just need to make sure that we can get policymakers to get it as well, so we can make this change.
Wow. Yeah, 8 out of 10 Kansans understand the importance of expanding KanCare. It's pretty powerful. So, this interview, this discussion to me has really clearly stated and demonstrated the importance of expanding KanCare in Kansas and so many different reasons why it's important to do so. And I know that, again, April, you and your colleagues and a whole wide group of stakeholders have been very, very busy working extremely hard to help the legislators expand KanCare over the past, 10 plus years or so. So if someone wanted to know more about the work of the Alliance for a Healthy Kansas and the efforts that you lead, how could they find out?
I'm so glad you gave me the opportunity to talk about that. So there are a few different ways to get involved. Organizations can become part of our coalition. We have a coalition of, right now we're at about 125 organizations across the state that have joined forces to work towards expanding eligibility for KanCare. We also have opportunities for individuals to be involved. And that includes anything from just joining our email list so that you get updates about when things are happening with expansion. And then also we've started a new Healthy Kansas advocacy community where people who are interested in advocating for this policy change can get together and really strategize and come up with ideas for ways to reach more people with the message about the importance of expanding KanCare. The easiest way to tap into any of those types of resources would be through our website. So that's www.expandcancare.com. We also have social media. So right now we have a presence on Facebook, Twitter, and very newly TikTok, which is kind of an exciting development for all of us. So I would encourage you to seek out our website and try to, find the right fit for you to be involved.
Yeah, and I cannot state enough or be positive enough about how it's been such a great opportunity for us to be part of the Alliance for a Healthy Kansas coalition. And the information that you provide, the resources that you provide, the opportunity to work together with a larger group. And I love the fact that you have opportunities for individuals as well to really join that effort and to speak in a united way with hopefully a little bit louder voice that goes to our legislators, again, encouraging them to think about expanding KanCare and to do so in the 2022 legislative session, because we really, quite frankly, can't afford to wait any longer. So again, April, I thank you, and I thank your entire team, and all of the stakeholders that you serve and that you represent for the hard work. And we're there with you. We're going to be there with you the entire session, and appreciate you spending your time with us today. I know that you have a lot on your plate, and it's very helpful to have you join us.
Well, thank you so much. We appreciate your partnership, and I'm so grateful for the chance to hopefully build our movement a little bit through your listenership.
Health is so much more than treating illness or disease. It is about being healthy and staying healthy. And to do so in a world where healthcare itself is complex and changing almost seemingly daily, and quite frankly needs to change because our needs as patients and individuals also change. With people like April Holman and the entire Health Alliance for a Healthy Kansas Coalition, we are all committed to working toward that new future, one that provides wellness for everyone. A healthy Kansas means all of us together. It means individually and collectively, we are all worth it. I am Denise Sisman. Join me next time for another State of the Heart.